Hi, it's Dr. Jenn Kennedy. I'm a sexologist and couples therapist. The Pleasure Project podcast is about sex and relationships. So this includes discussions on desire, dysfunction, dissatisfaction, exploration of all things sex related. So sometimes I'll do toy reviews and we'll look at trends, and sometimes I'll also enlist other experts. We'll increase your insight and enhance your pleasure. So tune in. Hi. In this episode, I sit down with Cre Chritz. She is a psychiatric mental health nurse. And so she has this unique perspective of understanding sort of what's on the medical side, but also what's on the mental health psychological side. So we talk about antidepressants specifically, also meds for anxiety. What do these things do to your libido? What do they, what are the trade-offs for them? I know a lot of my patients really hesitate taking medication. So understanding what's at play with a real eye on women's healthcare and women's sexual healthcare. So we also talk about postpartum, some of the issues that come up in that time during pregnancy, pre and post, and how that changes, and in terms of like what to consider from a mental health perspective. We also look at alternatives to just taking a pill. So there's intimacy creams, there's different options that you can take to help with your intimacy. So tune in and would love to hear your feedback. So welcome back. My guest today is Creinthea, who goes by Cre Chritz. She is a registered nurse. She's an advanced practice RN, a psychiatric mental health nurse practitioner, and she has a master's in secondary education. So welcome.
Thank you.
She started her private practice, which is called Coherent Care, and it's about women's and maternal mental wellness on the premise that women deserve concierge care in all stages of womanhood and motherhood. With experience as an educator, she fosters a love of teaching and advocating. She teaches patients to do the same for themselves. Cre began as an ICU prepared and registered nurse, which led her to training for several other specialty positions within the healthcare field. This ultimately led to the realm of psychiatric and mental health care. Having experience in hospital-centered care, inpatient, outpatient, and private practice care, she brings years of experience addressing the mental and medical connection. Her practice gives women an empowered sense of peace, an elevated sense of self, and an enjoyment of self-care. So, welcome.
Thank you.
Yeah, so this
I'm happy to be here.
Yeah, I'm excited to have you here because we had a conversation before in preparation, just really looking at how this intersects, right? Like how sort of the medical side of things, which is definitely one of the factors that comes into sex and sexuality. Also, the biological piece plays out. And so getting more perspective on that, I think, is going to be really helpful for the listeners.
Absolutely. Interesting caveat to that is I ended up wanting to know more about addressing all these different other realms of mental health from speaking to somebody who is a sex therapist. And she was like, have you ever listened to this podcast? You have to start. And from there, it just sort of ballooned.
Oh yeah. So it's like, okay, people in our world's paths are saying, hey, these two need to cross.
Yes.
Well, it's a difficult time in women's healthcare. I mean, I think it's always, women have just notoriously been underserved, but we're at a specific time in history where women's healthcare might even lose some access to care. So what have you seen trending in the patients that you're working with recently?
It's funny because when you and I spoke prior to the recent changes in our government, there was still the echo of the conversation of the taboo behind mental health care and a sexual conversation with a provider, which most of them were dominantly male. When it comes to psychiatric providers, just not something that's ever been truly openly discussed without any sort of sense of stigma or shame. And that also dates back to the 1800s. But so this concept of what's happening to my body and how can I safely have a space to talk about it. And often there's a sense of, is this an OB-GYN conversation or is this a psychiatric conversation? Because it's a matter of, is it my parts or is it, intrinsically me? And now we're shifting more into more of a space of what are my options out here that may not necessarily be more historic options. So there's a lot more women who are trying to figure out what can I do that may not be as aggressive, like surgeries or long-term care. What can I do for myself that may not be just your typical medication or allopathic or traditional westernized meds, but looking at other options as well.
Right. Well, some of that's the preventative care. Some of that's also just, like you said, self-care to enhance, their
Oh
well-being
yeah,
in general and all
yeah,
of it. But yeah, looking at not just assuming the default that they can get access to the care they need at all times with
exactly.
their historical provider.
Oh
Yeah.
yeah. I mean, one interesting part to consider is even just with the Olympics that recently happened. I know that's probably kind of a far cry, but I promise it's going to make sense. So with the
Okay.
Olympics, they were talking about how this was one of the first times in history for women in the Olympics where they had rooms dedicated for nursing mothers and women who were postpartum. Olympics has been around for so many years, and yet this is literally one of the first years where we actually had a designated space. So, because of that, I also wanted to mention postpartum and perinatal care has also become part of the forefront of what's happening to women during that time period that their bodies are changing and not just throwing at them, this is what's normal, you need to be going through this, but addressing there's a lot that happens in that time period, and that's okay to talk about it. We should be talking about it and not shaming women and giving them options and talking about these different stages.
Yeah. Well, first of all, the fact that someone could be nursing while they're at the Olympics means that they're at that elite level and they're also in that full of hormonal, changes, and also the pressures of being a mother. That's pretty intense. Yeah.
Absolutely. You
Yeah.
could barely
So
get me outside for a walk after I had my baby.
no, can you imagine being at the Olympics?
No.
No, no, it is not happening. Well, one of the things we had talked about that I think definitely comes up with patients is talking about the relationship between antidepressants and their fear that it's going to affect their libido, and that's oftentimes both men and women, but women we're a little bit more focused on in this conversation, have some hesitancy to go down that road because they're so afraid that it's going to kill their sex drive. And yet, oftentimes, the depression is actually killing their sex drive already. So, can you speak to kind of that conversation a bit?
Absolutely, 100%. So I often have conversations with patients where they come to me and they say exactly what you had said. Like they want to try something, but they're concerned about, am I going to have to lose this to gain this? And there are definitely medications that will inhibit blood flow, and some will be responsible for tanking a sex drive, and some that won't. It really comes down to hormones that are released. So, for instance, a big hormone that is released during sex that messes with our libido would be oxytocin, which is primarily seen in the hypothalamus. The dopamines, the endorphins, the prolactins, the serotonins. And many of these medications that we're on really address that serotonin. And the interesting piece about it is that when you have a high dip in serotonin, it flips with the libido. So that's really interesting. People who are on like SSRIs, selective serotonin reuptake inhibitors, which really help to give you that sense of that tranquility. Because on the flip side, if you're leveling out, you know, that balloon isn't going to float the same way to get you where you need to be if you're really working to really curb any sort of intensity in your system, because that's very much a sense of calm, no fight or flight, no, anything that's going to rise your anxiety. But even outside of it, there's definitely medications that are for anxiety, like beta blockers, which will slow your blood flow. So a lot of people notice that they have a hard time reaching orgasm or taking a long time to be able to achieve. There's also a lot of obviously cardiac medications like angiotensins, and anti-seizure medications as well. As they lower the threshold for sexual pleasure and gratification, and also our testosterone and that pleasure detector in our amygdala. But the whole point on
Yeah. So
that.
wait,
Sorry,
going
go
back
ahead.
though, I want to talk about
Yeah,
specifically antidepressants because I feel like that's
yeah,
one of the big ones that,
yeah,
I'm finding more and more patients really are hesitant. So break it down a little bit further. So what
yeah.
actually happens with the SSRIs or what most people are taking? So
Hmm.
chemically, what is happening? Explain that in
Yeah,
like simpler
absolutely.
terms.
So, yeah, so going back to when I said the hormones released during sex or with our libido, the oxytocin, the dopamine, the endorphins, and the prolactin, and the serotonin. Now, when we are on these sort of medications, it really affects serotonin, dopamine, norepinephrine. These are key ones. And when you're on a medication, let's say for somebody who has really high anxiety, it's going to do the flip side of that. So it's going to try to level out that norepinephrine or that epinephrine or that fight or flight or that
Mm-hmm.
sense of, honestly, that pleasure principle, that excitement gets lulled a little bit more so that you are not going to have such high anxiety. And on the flip side of that, create more of a sense of tranquility. So that's why people who are on a lot of these medications will say, well, I don't get quote unquote worked up anymore, but now quote
Yeah.
unquote, I don't get worked up anymore, you
So they
know?
don't have the highs and lows. It sort of takes them more towards the
Yes.
center, and
Yes.
sometimes
That
there's a
plateau.
blunting of emotions.
Yes.
Like, yeah.
Yes, that's exactly what the word is for. It's an absolute blunting, and it
Mm-hmm.
carries over not even just from emotions, but heart rate and then arousal as well too, because it literally does everything to keep the body leveled in all way, shape, or form, so that
Mm-hmm.
we're not triggered to be able to feel anything that could potentially meet a high
Mm-hmm.
change in our situation or our structure in our brain, which also does mess with our sexual arousal. When you're
Mm-hmm.
sexually aroused, you're, everything from your heart starts to race. You might get a little bit more diaphoretic or sweaty, when your body kind of prepares to have that pleasure principle, and it's going to lull that. But I will also say that there are medications that are not as likely to have that. But what
Mm-hmm.
I'm also finding is it really just depends on the person as well too. So, for instance, I've had somebody on a really low dose of something like Lexapro, not a problem. I've had
Yeah.
somebody on really high doses of Prozac, not a problem. But sometimes even the smallest amount can have a huge impact as well. So that's why some patients will end up they'll be like double dosed on two different medications that will
Yeah.
hopefully help by bringing some more of that norepinephrine back in, like Wellbutrin, which does work with norepinephrine, which is that go up and get them in that excitement medication or that hit of dopamine that will help.
Mm-hmm. Yeah. And how long do they take the medication before they're going to notice if it's affecting their sex drive? Like, what's realistically a
If
time
it's the
period
sex
before they
drive.
would know? Yeah.
Fair, fair. So, there's also something else too. I remember having a conversation with another colleague about this because I have had people say my sex drive was great, and then all of a sudden I take this med and I have no sex drive.
Mm-hmm.
And it also, people have to consider these medications are built to combat whatever your symptoms were previously. So,
Right.
in doing so, that's going to mess with that. So, if you take a medication that's going to slow you down and get you to calm yourself, you're not going to be as pent up and doing something to try to find a calm because
Yep.
now you're naturally getting that. Um, so, I would say that when somebody is beginning a medication, usually there's a good, I'd say, week that we typically tell patients to give your body time to just get used to it. There's also a titration period, which means the time in between going up to the next dosage or down, vice versa. But I would usually say within a good 2 weeks, if you're noticing that you're really taking a dip, talk to the provider. Sometimes they
Mm-hmm.
might add in something to help to supplement. Like I said, there's usually an addition of Wellbutrin, and if that does the trick, you can work yourself off of it. And sometimes the body just needs to catch up with what's happening. But if
Right.
it's still consistent, it may not be the med for you, but not all of these medications are going to inhibit that.
Yeah. Okay, so let's shift gears a little bit to some of the other meds, specifically blood flow. I mean, I know a lot of times men are having issues with erection achievement when they're having heart medications and that type of thing. What are other medications that specifically affect women, maybe regarding blood flow?
Yeah, so some of those other medications that I had mentioned, they're not necessarily in the mental health realm. They're more in like the cardiac realm, like the beta blockers, which are actually used not just in like regular medical, but they're used in psychiatric care as well for heightened anxiety, and that
Mm-hmm.
slows the blood flow. So anything that you can think of that is an anti-anxiety medication, even opioids or benzodiazepines, which are used for really bad panic attacks or generalized anxiety disorder. So when somebody's going to take those, it's going to slow down that blood flow and trigger more of that relaxation response. However, we need that blood flow, when we're aroused. So
Yeah.
that's extremely important. Some people will also be on mood stabilizers or anti-seizure medications. They're interchangeable, like Tegretol, carbamazepine, Lamictal, and they lower the threshold for sexual pleasure and gratification because it's supposed to keep you from hitting that point to where there could be a fight or flight. So things like that will really mess with a woman as well as a man,
So
really.
they
But
might physically feel good, but they might have difficulty with the building sensation that typically is associated with
yes.
like orgasm. Okay.
Mhm. Mhm.
Yeah.
Yeah, and that's for the anti-seizure meds. But for those other meds, like I said, any anti-anxiety medication is literally meant to keep you from having that buildup. It's literally keeping. It's like if you're constantly pouring water into a cup at like a slow state, you're not going to get that splash out effect, a climaxing effect or something like that. So if you're constantly doing just a simple, tranquil, consistent pour, nothing amazing is going to take place from that. And the same thing with our sexual arousal and our
Yeah.
buildup of blood flow to our necessary organs.
And then how about supplements? Are there any supplements to be sort of on the watch for? On the one side would be preventative or maybe enhancing.
Yeah. So I talk a lot about this in my practice too, because I definitely was on the mind frame of working with just medications with a lot of people. And then I started learning more about the holistic and alternatives because not everybody wants to be on a medication, so they've had really bad side effects, sexual side effects, have you, as you had just mentioned. And I started learning more about what are some things that may affect mood, energy, or even just the interest. And there are some that I like to work with. One of them is vitamin B12 injections. And what I like about that is it really helps with a few different things. For one, there's a lot of women and moms who feel like they are drained constantly. And that
Yes.
is also like that psychological factor
Yeah,
of the
that's definitely
expectations.
happens.
Yeah, there's so much that we're constantly doing. So there's that energy piece, and that affects our moods. Focusing too is a huge piece too. So there's a lot of, women of the time frame. Many of us are working or we're professional. We have a lot of things going. And even if we're at home, there's a lot of things that we're still having to juggle. And it's hard to clear your head emotionally and physically to be in that space, to be intimate. Um, Especially with also seasonal blues too. So a lot of my moms, fresh moms, do like to use B12 injections for those who are newly postpartum as well, because it can really help with that postpartum blues.
And
And
how
with
frequently
vitamin
are they getting those?
Good question. So with vitamin B12, some people will take it up to two, sometimes even three times a week if it's really small doses. Some, if they go with a larger injection, probably about once a week, and then do that for about maybe 2 months, and you'll pull back to more of a maintenance dose, which may be like once every 2 months or so. But there's some people who like the way that it's helping them, and they like to keep on a consistent run with that. And then some people ask, well, how do I know if too much is in my system? The nice thing about B12 is if you have too much of it in your system, you'll excrete it naturally in your urine. So it's not something you can overdose on, which is nice,
Yeah.
contrary to some medications.
You had mentioned too the attention component for those folks that are on ADHD medicine, and that could be Ritalin or, Adderall or any of those typical
Yes.
ones. Does that affect any of what we're talking about?
Yes. Yes. So there's another one called NAD plus injection, and that's, I'm going to butcher this name. I was going to say it really slow. Nicotinamide adenine dinucleotide. And that is essentially for cell metabolism. And what I like about that, and I'm so glad you brought that up too, because there is a huge connection between ADHD symptoms and intimacy, as well as fatigue, as well as that brain fog and cognitive functioning. So for a lot of people who were like, I've been on attention deficit medications, I've been on the amphetamines, I've been on the Vyvanse, the Concertas, the Adderalls, I have to do something different. I can't maintain this. It's expensive. It's highly regulated because it's a controlled substance. The
Yes.
NAD plus injections are nice because they do help with like the cell metabolism, and it helps with aging. It helps with chronic fatigue, myofascial therapy, myofascial therapy. And it really helps with that brain fog as well because it works with the mitochondria and like our base of our cells. So as we get older, we start to produce this enzyme less and less and less. So that's why people who have ADHD will be like, I'm just a mess. The older they get, they just get worse and worse. Rather than when they were younger and they're like, oh, I had different coping mechanisms for it. But as they get older, it's not working. And then sometimes they've already used all those medications around the clock and they need something different and more consistent. And that one's every 2 weeks or so. It's not very common that you'd have to use.
Any other supplements that you specifically recommend to support women kind of at different stages?
Yeah, absolutely.
Hi, I hope you're enjoying the episode. Wanted to reach out to you. This is Dr. Jenn and say, hey, if you would like to deepen your own experience with this, there's a couple options. If you head over to pleasureproject.us, you will see several things. There's lots of articles. There are also merchandise items that you can buy if you're feeling enthusiastic. You want a tote bag. We've also got fun cookie cutters. You can also join the wait list for an upcoming Pleasure Circle, which is a small group intensive that I lead. Would love to have you. If you want to know more, check out pleasureproject.us.
Well, I do like the vitamin D injections, which are usually once a week. But some people do prefer to do like a once a month, especially if they're also combining that with vitamin B12. I know that's
I feel like
really
every woman I know in her
workers.
50s is low in vitamin D. It's like that is like universal. Everybody's low, including me.
Yes. And also for shift workers and hospital workers. When I worked in the hospital, all of us were always told our vitamin D was bad, but also because we're also in these rooms with fluorescent lights all day. When you don't work outside, you're not constantly outside in the sunshine, which does give us a natural dose of vitamin D.
Yeah.
You're not getting those energy stores. It also helps tremendously with immunity as well, too. And it's also really good for new moms. Like I said, that energy level stores too, and the mood as well.
You can also take that, like you can take, like my doctor gave it to me in little drops that I put in my water, or there's also like a pill I can take, right, for vitamin D.
Yeah. So some people have to do it that way. Some people like to do more of like a intermuscular or subcutaneous doses. It stays in their system a little bit longer and they can feel the effects faster. Rather than doing over the counter or, supplements that they get from a Trader Joe's or Amazon or something like that. It's kind of just, to each their own. The last one would be like, there's amino acid blends that really help with like cravings and depression and anxiety symptoms, which I know is a big thing for women too, especially new moms.
Recently also, I had talked about with a physician about oxytocin nasal spray. I don't know if you've worked with that at all, but for lowering cortisol.
Yeah. Well, I've actually worked with oxytocin films as it relates to the sublingual films for intimacy. So that's really...
Okay, say more about that.
Yeah, sure. So and I remember you had asked me about some options for like women and or partners when it comes to intimacy. And films is definitely one that is not often talked about. So essentially it'll increase plasma levels and what we call catecholamines during sexual activity. It essentially just works to alter the perception of arousal. You feel more empathetic, you feel more trusting of your partner. And you
so wait, when you say films, I'm thinking of like those little ones that like those Listerine strips. Like, is it kind of like that where you just put it on your tongue and that's how you take it? Okay.
It's a sublingual film. So you lift your tongue and under your tongue, you know how you have all those little veins right there? You have a lot of like, it's called the blood-brain barrier, which just means that it goes into your bloodstream very, very fast. So you would put that film right under your tongue about 20 or 30 minutes before activity, and it's just supposed to really enhance that experience. And it works for men and for women, which is really cool.
And who do they go to get this?
Well, they go to a prescriber. Unfortunately, this is not something that would obviously be over the counter. Unfortunately, we're not quite there yet as a nation, but yeah, it's currently, that is still something that they would have to go to their provider for. And
they would go to like their GYN or their primary care or who?
So I honestly only know of maybe one or two other providers that do this. Some OBs, like I said, they're not really they're not guided towards working with mental health care. So they're going to work on the functionality of those organs, not necessarily arousal and anything that they would consider to be psychosocial or like psychological. But if you were to press them for that, they may be more likely to consider that, but they probably would have to do more research on it, because not everybody really talks about what are we doing to enhance arousal outside of, usually they might say a cream, or
Right.
lubricant, but creams and lubricants don't usually have to do with arousal. It's more for about the act itself and being lubricated.
Mm-hmm. Yeah.
But the
So
nice
these
thing about
films,
this,
okay. So they would drop in under their tongue, and then it takes how long to take effect?
about 20 to 30 minutes.
20 to 30 minutes. Okay. And they're going to feel maybe more amorous, more
Yeah,
connected.
yeah.
Mm-hmm.
Yeah,
Okay.
they say like it just increases that sense of empathy, trust, just an enhanced sense of like relationship building. Like they say that this is the same hormone that is released when a mother has her baby, something
Mm-hmm.
like that, where it's that sense of just, you just feel connected and you just feel this complete sense of like tranquility wash over you. And for many people, that is just an extra piece to the puzzle during sexual activity.
Yeah.
But there's another piece to this too, is that not all prescribers probably would know about this, because many of these things are created in a compounding pharmacy. So not a lot of pharmacies are going to create them or do them, because they're just, some pharmacies just, they don't have the technology or the structure for it, or they just don't offer these things. Like a compounding pharmacy, the nice thing about it is that they can do doses of different things, different forms. So for instance, they can do films or versus pills or the spray, like the physician who you spoke with. They can do things that are compounded to be vegan or have dye
Hmm.
free or allergen free, or to be shipped on ice. It can protect your identities. You don't have to go to a pharmacy and ship right to your home. Sometimes it's even cheaper because they don't use the typical dyes and some preservatives. Some people even use compounding pharmacies for HRT, ketamine, creams and dermal treatments as well. So that's why I like to use compounding pharmacies personally.
So that would require your physician having a relationship with a compounding pharmacy to
They would need to
coordinate.
have done that. Or they
Mm-hmm.
can simply make sure that they're writing a script to a compounding pharmacy, but it would usually require them following up and being partnered with one. I just think it's always nice to have, and some providers do that, especially if they're already partnered with the pharmacy that does HRT or ketamine. So if you already are getting that from a provider, you know that they do that, chances are they
Mm-hmm.
already are partnered with the compounding pharmacy.
And what is that process like for you when you're interfacing with like I know you said you're like kind of in partnership with them. So are you saying this is what I'm trying to address, and then they're looking at the proper like dosage, or like how does that go?
That's a good question. So, when I had decided to start working with compounding pharmacies, the initial thing that I knew was I wanted to find something that was going to address this issue. And I know that I wanted to work with it being in this form. So, usually you
Mm-hmm.
start off with thinking, like, I want a form that's going to be sublingual, or I want a form that's going to be a troche, which is like a dissolvable lozenge that you can just
Mm-hmm.
put on the inside of your cheek. And often they will already be able to complete many of the same medications that you would get at like a regular pharmacy, but then they can do these additives to make it. Well, do you want to change the dosage? And then you can have a conversation with them about what you're trying to create specifically. So, for instance, for patients who have like vulvodynia or like pain during intimacy, I went to the compounding pharmacy and I told them that I wanted to work with him, that to find something that could really work with pain during, after, whatever have you, when it comes to intimacy. And I wanted to make sure that it did combine certain things such as gabapentin, or diclofenac or something like that, that can really help with like dulling the nerve senses. So then they have a conversation with you to determine what is a good combination of these medications to be able to get them that desired result.
Mm-hmm. Right. So really looking at the patient profile and understanding what are you trying to achieve, and then nuancing it so that what is created Yeah.
Yes, yes, which
That
is
is a
really
very
nice
custom
because for a lot of
experience.
pharmacies, this is what we have. Come pick it
Mm-hmm.
up.
Yeah. Yeah. Well, and how helpful that would be. And I will say pain is a big presenting issue for women, especially menopausal women, as they I mean, it happens throughout the life cycle, but yeah, definitely they're coming in, and lack of lubrication and then pain with penetration is a big issue that keeps them away from wanting sex. So
Oh
having
yeah.
some solutions for that is pretty helpful.
Yeah, I actually came across learning about this after I spoke with a pelvic floor therapist who I partnered with because she had said, well, Cree, I have a patient that's not necessarily interested in being on a medication because there are technically medications that are quote unquote supposed to help with that, like tricyclic antidepressants are supposed to help with nerve pain, or amitriptyline, which is also a TCA that's supposed to help with that. But not everybody wants to be on an antidepressant for being intimate because, for instance, I had a patient say, I don't want to have to take a medication every day because I have sex maybe once or twice a week.
Yeah.
That's not fair. So, it was nice to be able to have a conversation about, okay, well, what can I do to address women who want to be intimate in that moment? And
Mm-hmm.
she actually was talking to me about these different options that she had heard from somebody who she met in, I believe, like Pennsylvania or Massachusetts. And they're a very small practice, but they worked primarily with women who had PCOS, or like I said, vulvodynia, dyspareunia, pain with intimacy during, after. And I learned a lot about that. And then I called up my compounding pharmacy and I talked about, like, this is what I would like to have mixed. What are my options here? And so that really helped, even something as simple as they don't have to be. And the crazy thing about it is that they don't have to be controlled medications. So these don't have to be something that's big and hard hitting and crazy. So for instance, baclofen is supposed to be a really interesting, like, nerve preserver so that it really helps to dull the senses there so that they can relax their pelvic floor. Even
Mm-hmm.
something as simple as that, not a controlled substance. Now, on the flip side, for people who have had, for instance, PTSD, believe it or not, it is possible to get diazepam, which is Valium, in cream form that can be a suppository for women for
Hmm.
pelvic pain too.
Hmm.
Yeah,
Mm-hmm.
listen, I learned something new every day.
Mm-hmm. Yeah. Wow. So having the suppository, so then they insert it and then it starts to kind of slowly like
Mm-hmm.
coat the channel, and that helps
Mm-hmm.
with maybe the involuntary spasming, or what, how does that?
Yes,
Okay.
yes, absolutely. You're right on there. So it'll release that pelvic floor, that sense of, like, that the muscles tightening and
Yeah.
not having that sense of enjoyment or release. You even just get to the part of even becoming intimate and even allowing your body to be able to allow any sort of penetration.
Right.
And then you couple that with maybe like for instance, they say, well, do you want to add a muco adhesive? Muco adhesive means, like, if there's going to be movement, you back and forth, if you're having
Mm-hmm.
penetration, you want that medication to still stay within the walls of that, the woman's, you know, vagina.
Mm-hmm.
So you want to be able to make sure that it stays in that location. What I really like about all this too, which is like my saving grace, is the fact that these are like sensitivity. These are
Mm-hmm.
sensitivity tested because they have to be, with these sort
Mm-hmm.
of pharmacies, they have to be really mindful about any sort of topicals and dyes. And
Mm-hmm.
they exist primarily because people go to them because they have aversions to dyes or aversions to different,
Yeah.
like, preservatives that other medications might have, which I thought was so cool to learn about.
Yeah. Well, and it's like those little thinking about, I've just those little subtleties of consideration for her experience. And when she's having, yeah, like you said, if there's going to be friction, which typically that is what's happening during penetration,
Mm-hmm.
a lot of times women, it's a feedback loop of pain, and so they choose to opt out because it hurts, and it might
Yes.
hurt somewhat in the moment, but it's going to hurt a lot later. If you don't have sufficient lubrication, you're going to get those micro tears. And
Yes.
so a lot of menopausal women just kind of opt out. And if they can have, more targeted conversations with their healthcare provider to see what's
Mm-hmm.
possible to make them more comfortable,
Mm-hmm.
but they have to be able to say, this is my previous functioning, this is where I'm at now, and not feel embarrassed about it, but have it be
Exactly.
a collaborative conversation to help their body. feel better.
Mm-hmm.
Yeah. And the pelvic
Absolutely.
floor component too, I feel like that is sort of just coming into light, which is amazing because the pelvic floor physical therapists are amazing, like
Yes.
really, really helpful. And I wish that more women understood their pelvic floor
Yes.
pain and limitations so that they could get some
Yeah.
support around that.
I mean, I'll be full disclosure. I didn't even realize what they did until I was postpartum. And
Yeah.
when they said there's a lot that happens to a woman's pelvis, like it's a trauma that's happening to your body. So getting things back into place and the shifts and stuff like that, like there's, for instance, vulvodynia that can pop up on a woman after she's had years of painless sex, and all of a sudden, you know, she starts to swell up and there's pain in places that didn't used to be. And sometimes, you know, they're only ever offered the concept of, okay, well, then do you want to be on like estrogen therapy? Do you want to consider Botox ingestions to relax your pelvic floor, which can be invasive and costly? And there can be other options, just like I mentioned, like a suppository or something like that, that you can have before intimacy, or films or something. It doesn't have to be you're taking a medication every day for those times you are intimate, because I not some people every day, but not everybody, or every single day.
Yeah. Well, and you had mentioned pregnancy too. It's like I have not had children. I have not had children, but I have friends that have talked about this huge swing that happens, how much uh, sexual interest they had while pregnant, and then the complete cessation that happens after they give birth. I mean,
Yes.
in part because there is trauma,
Yes.
but also just from the hormonal side. Can you talk about that a little
Yes.
bit?
Yeah, sure. So, you know, it's interesting because I've actually met, on the flip side, more women who lost their sex drive when they got pregnant because of all the social changes that was happening. So they're more stressed. They're worrying about baby. They're thinking, do I look good? Do I have, like, how should we do this? Should we have the lights off? Now I have stretch marks and blah, 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 blah. All these other different things, like what they used to look like, blah, blah, blah. But they say that a lot of the social changes are in connection to that libido hit for the sex drive. But a lot of older data is suggesting that, okay, well, your children are older, you should be more comfortable. You know, this is fine when it comes to women who have been past, you know, pregnancy and had their children. But when they are pregnant, you might see higher serotonin levels that are associated with lower libido. But on the flip side, there's someone where it's completely flipped, where lower levels are associated with a higher libido. So there are higher cortisone levels where they have lower levels of serotonin. So then they have a higher sex drive. So, you know, it's interesting how that can flip, and how that can flip once they end up having a child, and like all those hormones are completely out of whack.
Right. So it's not
So,
like a one size fits all predictably
oh no, it's
going to
not.
happen.
Absolutely. Yeah, I mean, and some people might say that they typically will see a decrease in the first trimester, and that's because of the increase of the serotonin levels alongside with like nausea and fatigue. And then they might see more of that peak come back after their second trimester. But it's very much physiological as well as I'd say, like, you know, psychological too. But I mean, I know plenty of women where I was like, do you just want to have sex all the time? And there's some were like, no, I don't want him to touch me. On
Yeah.
the flip,
Yeah.
some were like, gotta have it, and he can't keep up.
Yeah. 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 And then there's women that are, you know, they're afraid they're going to hurt the baby. And it's so funny.
Yes,
Like it's so all over the map in
yes,
terms of what I hear.
yes.
Yeah.
And men too. There are some women who were pregnant and their partner's afraid, so then they're not getting any because their partner's afraid of hurting the baby.
Yeah. Yeah. It's like, you're fine. Go for it. Yeah. And then the postpartum piece, when women are having postpartum depression specifically, and just what's happening in their body when that's happening, in their biology.
Sure. Well, that's a good question. There is a lot that takes place. Long story short, you've got about 2/3 of the change in sexual functioning. I was looking at some research about it recently, and I was shocked to hear that. But it said when it comes down to hormones, there's a 2/3 shift of your body's hormones that completely make a shift after you have a baby. That is a lot. And in that time period, you remember I was mentioning just even like the concept of sex, and like some women might not want to, or everything going through their mind if they're going to. And then think about that shift too. And you have to think about how your body looks. You have to think about anxiety and OCD. There's intrusive thoughts sometimes. which is unfortunate, but it happens a lot more often than people think, which is in connection to anxiety and OCD, because you have this brand new life and now everything's come out of you, and you are now built to keep this thing alive. And you need to start producing prolactin, whether or not you choose to breastfeed or not. Your body's still going to be in preparation, expecting to do so. And there's that decreased input and that sense of self for you to take care of a child. So there's going to be more of that estrogen being pumped into the sense of, I have got to take care of this life in front of me. And that's why they also say that men actually have an increase in estrogen after a baby's born, because it goes back to caveman times. Mm-hmm. So they would stay and defend the family and not leave to go procreate elsewhere. So that sense of, I have to now pour into something else that I've now birthed versus thinking about myself and my needs. So that sense of pleasure really takes a hit for a lot of women, especially if they're breastfeeding, because, you know, they're already pulling on a part of our body that can be sensual for a lot of us, you know, pre-baby. So that's also really changed a lot too. So couple that all with postpartum anxiety or depression. There's a lot of data that suggests that, well, first there's the postpartum blues, which in about the first 2 weeks or so, which is quite normal. And then, but that postpartum stage really will last up until about a year. However, they're really starting to push it now to say about 3 or 4 years of age for that child. Yeah, I'm seeing a lot more women who are still going through the woes where their child is 2 or 3 and they still have mental brain fog, you know, and that is a connection between like our brain, our gray matter in our brain actually starts to decrease after we have a baby and it has to rebuild again. So yeah, there's physical changes or sexual changes, all of it.
Yeah. Well, and then oftentimes women are getting pregnant again in that time period, right? And it's a cycle. So they're in years of like in and out of hormone fluctuations, and it makes it makes it more complicated. Yeah.
Yeah. I mean, and estrogen levels are dropping drastically too, which is in connection to physical and emotional changes. They're going to have mood swings. They're going to have hot flashes. I had hot flashes and I didn't understand what that was.
Yeah. Yeah. Welcome.
But there's also the possibility of incontinence too. You know, they're trying to, like, your pelvis is still trying to shift back to where it was. And you try to couple that with trying to be able to use the restroom normally again. You know, that affects your mental state completely, because you have 2 people in the house in diapers now. So it's a lot.
You know, it's funny. One year I got a trampoline for Christmas. And all my girlfriends that came over that have had kids are like, I can't get on that thing. There's no way I could ever jump on a trampoline again. I'll pee my pants. Like,
you better wear black.
To me. You're like, that's not happening. Oh, well, thank you so much. Okay, so tell us what projects you're working on.
Absolutely. One of the things that I'm working on is it's called Miseducation of Mental Health, which is a series I've worked on with another therapist called Sheila Hughes. And we're really working on what are some of the things that we have been taught or learned or stigmatized about mental health that we need to refocus and relook at and completely disband and recreate. So, you know, we've been talking about it's a series that's been every Saturday through the month of November, but we're trying to turn it into something that's more, you know, more of a serious situation. But we look at all things like, what are certain medications? What does it mean to read? Even something as simple as, how do you read your medicine bottle? Because some people don't understand what's on the medication bottle. They don't know how to read some of that. Even something like learning about psychedelics and psilocybin, marijuana use, alternatives and holistics, and what does that look like? And coordinating with some holistic providers through some spaces around town. And for instance, Colorado is one of the locations where I'm located, as well as Florida, Iowa, and soon to be adding Maryland, and hopefully coming out with a fun postpartum toolkit for moms, just so they don't have to go through some of the things I did.
Great. Well, we'll definitely put all your contact information in the show notes, so that if people are looking for you, they can find you. It sounds like you're in like 5 states now. You're able to work in those places.
4.
4 states. Okay. And tell me those states again.
Yeah. Florida, Colorado, Iowa, and Maryland.
Okay. Wow. You're all over.
Yes. I'm working. Listen, there's got to be more options for women out here. We all deserve to have some sublingual films.
Yes. Oh my gosh. I agree. Yeah. Well, thank you. And then let's see. So, where can listeners find you kind of in shorthand?
Absolutely. So they can go to my site, coherentcare.org. They can, email me at support@coherentcare.org as well. And they can usually find me there. I'm on Instagram at coherent_care as well. But I always tell people to take a look at the site. I have lots of different things there and a little blog as well about things if they're nervous to get in touch at first too.
Sounds good. Yeah, I've been watching your videos, so they're fun.
Oh no.
No, they're good. Well, thank you for having this conversation. I appreciate it.
Absolutely. And thank you so much. I love the podcast. Like I learned so much every time that you post.
Oh, well, thank you. It's good to have you.
Hey, it's Dr. Jenn. Thanks so much for tuning in. Please leave us a review and leave a comment if something struck you. We'd love to get the feedback. It really helps the podcast. And if you want to reach me, go ahead and direct message me on Instagram, or you can reach me at jen@rivieratherapy.com. Thanks.